ear, with either ear, but you may have some type of neurological problem. I told him about my trip to Duke 3 years previously, and he said, "You have got to return." I told him I went to Dr. Odom, and he said, "I will write a letter to Dr. Odom immediately and have him see you again. You have just got to go back to see him." That 4-hour drive that I made home from Charlottesville to Martinsville was the longest trip I've ever made in my life. I had 2 weeks to wait before we received a letter from Dr. Odom who said for us to come back the next week. During that time, I went and I talked with our minister a lot, and I talked with Dr. Campbell. I heard through the grapevine, in a way, that I had many of the same symptoms as people who had multiple sclerosis. I was very concerned about this, and I wondered, would I be able to go back to school? Would I have to stay home for the rest of my life with Mama and Daddy? Would I have MS? I just didn't know. Finally, when the 3rd week arrived, Mama and I went back to Durham, and I saw Dr. Odom. I realized then that I could ask questions about things that he was doing, tests that he was giving. Now, why are you giving this test? What are you hoping that it will show? I said to him many a time. What are you expecting to see from this particular test and examination that you were giving? I never would have done that had I not been to the colloquium. By then, they had invented the angiogram. So they were able to give me an angiogram. And what the angiogram turned out was that I did not have so many of the diseases and the problems of all types that had been diagnosed for me. I had a brain tumor. The brain tumor was located in the left side of my head. Oh, so that is probably why my left eye and the forehead over here was numb. I wondered, what are they going to do? And Dr. Odom said to me, "We need to do a brain surgery and remove this tumor right away." I had never heard at that point of anyone who had had a brain tumor and who had lived. I knew no one who had. I talked to a physician's assistant named Maureen there, and I said to her, "What will happen if I do not have this brain surgery?" And she said, "Then you'll die." When I heard those 3 words, so many of my fears went straight out the window. And I knew that I wanted to have that brain surgery. I wanted to at least try. I wanted to get well. So I did. In September of 1974, I had that brain surgery. It turned out the brain tumor was benign. It was wrapped around the 5th nerve behind my eye, which was why my eye was numb. So the entire nerve had to be removed. For that reason, since the 5th nerve gives you feeling from here to here and here to here of your face, then that side of my face was numb. I had some good things that happened. My fingers were no longer numb. And that's because the left side of your brain controls the right side of your body, and vice versa. These 3 fingers were fine. I could write again. My foot was no longer numb. That was great. The biggest problem that I had was with my left eye. I could barely see out of my eye. They put me in a room after I was able to get out of the neurosurgical intensive care and said, "You are to stay in bed for a week." A week! In 1974, the neurosurgical procedure at Duke was that you stayed in bed for 1 entire week. Well, Mama read to me from a book about Spencer Tracy and Katharine Hepburn, which I really enjoyed. And my younger sister, Julia, was there too. She found a copy of Mad magazine that she bought and brought to my room, and it just happened to have an article about the most often used and most popular medical supplies. My favorite medical supply was one named Arctic Tail Bedpans. It had a picture of a man sitting on the Arctic Tail bedpan. His eyes were bulging out and his teeth were chattering. Julia described all of these cartoons to me, and we laughed and laughed over them. When the week was over, I was able to go into a regular room. I didn't have a television up above, which was probably just as well because I could not have seen it anyway. I had a little radio to the side, and I could listen to the news and to some music. One day, a friend of ours from Martinsville sent me some flowers. I asked the nurse to bring them up close so I could see them. They were pink tube roses, and I smelled them. Ah, they smelled wonderful. In fact, they were so fragrant that I had her to put them as far away from me on the other side of the room as she could get. You see, I have this great sense of smell. In fact, my brother Bob says the police ought to put me on a leash and have me sniff out illegal drugs. So, after another week went by, I was able to go home. I stayed in a single bed out on the porch on the main floor, so Mama and Julia didn't have to keep going up and down the steps to see me. I did okay for about the first week. I went back to see Dr. Campbell every day, and he started working on my eye. He first put some drops in my eye and gave me the drops to put in, and then said for me to put a patch of plastic, like the type of plastic you use in the kitchen, Glad wrap or plastic wrap, and that would keep the air out of my eye and maybe would help it to feel or help it to get a little better. I did that. I went to see him every day, and by the end of the week, he had placed a soft contact lens in my left ear to protect my cornea. Amazingly enough, my eyes started to do a little better. I would have to go by what he told me, though, because I couldn't feel anything in my eyes since that side of my face was not. By the second week, though, I started running a fever. Mama called Duke, and they said, well, bring her back, especially since the fever was getting a little higher every single day. They checked me out, and I had aseptic meningitis. This is the non-communicative form of meningitis. Probably, Dr. Odom said, from the trauma of brain surgery. But since I was not contagious, I could be in just a regular room. They put me in a regular room, and my roommate checked in later that afternoon. Her name was Bobby, and she brought along with her her husband Sherwood and her mother. Now, if you have ever watched the Carol Burnett show on TV, you may remember the sketch they sometimes did called Mama's Family. In it were Eunice, Ed, and Mama. That pretty much describes Bobby and family. Sherwood and Mama would come in every morning at 11 o'clock when the visiting started, and they would stay until 8 p.m. Sherwood smoked, which was allowed in 1974 in the Duke Hospital rooms. Mama brought with her enough food for the three of them to eat for the entire time they were there, as if the hospital didn't serve any food. Bobby objected to my mother reading to me, so every day my IV that I had to have to get me well from the aseptic meningitis would trek down the hall to the waiting room. And my mother would read to me from that book by Spencer, about Spencer Tracy and Katharine Hepburn. She finished that and then started on a book about Liza Minnelli's father, Vincente Minnelli. So interesting. I enjoyed that so much. We would come back to the room. I listened to Bobby for the 10 days it took for me to get over the meningitis. Bobby talked about the medicines she took, the ones she had taken in the past, ones that had worked, ones that hadn't, doctors she liked, nurses, technicians, ones that she didn't like. Every subject concerned her time in the hospital and her time of being ill. Now, I felt bad for Bobby, and I was sorry that she was sick, whatever it was that she had. But I could see that this was the main subject of her life, and I decided then that I was not going to let my illness and my operation be the main topic of my life. We went back home. I was over the meningitis, and I felt great. Not only were my fingers not numb, my foot was not numb. I could swallow my food without choking. I didn't have a fever anymore, and I had energy that I had not had in over 3 years. I did a number of things then, mainly going back to Dr. Campbell every single day. He saw me every day for about 3 months and worked and worked and worked on my eye to try to get it in good enough condition for me to return to graduate school in January. It was just a great time that I had when I felt so well. Because of this, when a friend invited me to come to Richmond and have and attend a little party that she was having, I said, well, yes. So my mother drove me to Richmond, and I went to that party. Now, I had been practicing eating while I was at home. Now, you know how hard it is to eat after you've been to the dentist and one side of your mouth is still numb from the Novocaine? That's what this side of my face is like all the time. I had to get used to that, so I put a little mirror on the table next to me, and I would practice eating and trying not to get food on this side of my mouth. We drove to Richmond, and I went to the party. Oh, I hope she's having something that will be easy for me to eat, I thought to myself. And then the food appeared. Spaghetti! Oh, well, I made it through that dinner, but I've never ordered spaghetti in public again. I returned to graduate school in January. I finished my MFA degree in 2 quarters rather than in 3, directed my thesis play, Suggs, by David Wiltz, graduated with my class, and came back to Martinsville. I was going to get a job as a professor in a college or university theater department, or I decided I was going to get a job as a director full-time for some type of theater. After I got back to Martinsville, I happened to hear from probably the Martinsville Bulletin, which was the only newspaper, was and is the only newspaper in Martinsville. The JCs were going to have a play there. There was a new little outdoor stage that had been built out in the county, and they were looking for a play director. Well, I could volunteer to be the play director, I thought, so I did. I proposed the play Story Theater by Paul Sills to them. Right before I had the auditions for the play, I met a nice young man in Martinsville who worked at Gravely Furniture there in the computer area. His name was Rick Whitener. He seemed like a nice person, and I just mentioned to him, now I'm having auditions for the play tomorrow night. If you are interested or know anybody who is, then please come out. All right, I'll do that, he replied. And the next night, he showed up. He had a good audition, so I cast him and 7 other people in the play. We started rehearsals. We saw each other almost every night at rehearsal, and after a month, we started going out on dates. Now, Rick was such a nice person. He was kind, very intelligent, just so thoughtful, and was enthusiastic about the rehearsals we were having. The only problem was, he was a terrible dresser. Now, his everyday clothes for work were all right because he could wear just regular slacks and a shirt, but the dress clothes were another matter. For the dress clothes, he had 1 suit and a pair of shoes, both of which were too small for him, and 2 leisure suits. The first leisure suit was light blue. The second leisure suit was dark green. And to go with the dark green one, he had a white, all polyester shirt that was short-sleeved, and on it were round balls. That's about the only thing I can call them. They were yellow and blue and kind of resembled rolls of toilet paper. Oh. He needed help. Could I supply help? I wondered. And then a voice came into my mind that said, "This is your mission if you choose to accept it." And I did. I started in on his wardrobe, and he began to look a little better after we had done a few shopping trips. We also continued with our play rehearsals, and right before the production, I went to the American Theater Association convention. You see, I had tried and tried during the summer to get this elusive job that I had wanted in a college or university in the theater department, and I had never heard anything. I'd had a couple of interviews, but nobody had ever called me back. So I went to this ATA convention, and there were 100 jobs available. The only problem was there were over 500 people who wanted those jobs, and many of them had years and years of college teaching